everyone, and welcome back to Rheum Doctor, your trusted source for clear, evidence-based information about autoimmune diseases. I'm Dr. Jessica Chapman. Today we're tackling a topic that can cause a lot of anxiety, the rheumatoid factor or rheumatoid factor blood test. Imagine this, you've seen your doctor, maybe you've had some aches and pains, and you get your blood test result back. Your eyes scan the page and one line jumps out, rheumatoid factor positive. Your mind might instantly leap to rheumatoid arthritis. You might envision swollen joints, a future filled with challenges, and a wave of worry washes over you. But what if I told you that that single test result is far more complex than it seems? Think of rheumatoid factor not as a definitive judgment, but as a detective that's just started an investigation, holding a clue that could point to many different scenarios. Today we're going to unravel this mystery together. Let's start at the beginning. What exactly is this rheumatoid factor, or RF, that we're talking about? In simple terms, rheumatoid factor is an antibody. Normally your antibodies are like your body's security guards, fighting off invaders like bacteria, viruses, but rheumatoid factor is a bit different. It's what we call an autoantibody. Auto means self. This means it mistakenly targets your own body's tissue, and specifically, rheumatoid factor targets a part of your normal healthy antibodies called immunoglobulin G, or IgG. It's like one of your own security guards getting confused and handcuffing another guard. Interestingly, some scientists believe that rheumatoid factors might have originally evolved as a helpful mechanism for the body to clear out old immune complexes, kind of like cellular cleanup crew. In certain situations, this process can become overactive or misdirected. While labs most commonly measure the IgM type of rheumatoid factor, it can also exist in other forms like IgA or IgG. Each of these might have slightly different implications. Researchers are still learning more about them. For example, some studies suggest that IgA rheumatoid factor might be linked to much more severe disease in rheumatoid arthritis. Why did your doctor order this blood test in the first place? Typically, a rheumatoid factor is ordered if you're experiencing symptoms that could suggest an inflammatory or autoimmune condition. This might include things like persistent joint pain, unexplained swelling in your joints, or significant morning stiffness. Rheumatoid factor is most famously linked to rheumatoid arthritis, or RA. 60% to 80% of people diagnosed with RA will have a rheumatoid factor. And in those with RA, the presence of rheumatoid factor can sometimes, but not always, indicate the disease might be more aggressive or that there's a higher chance of developing issues outside the joint, like rheumatoid nodules or interstitial lung disease. Now here's the crucial part, the big plot twist in our detective story. A positive rheumatoid factor test on its own is not a diagnosis of rheumatoid arthritis. Let me say it again. It's a clue, not a conclusion. This rheumatoid factor detective doesn't just work on RA cases. It can show up in a surprisingly wide range of situations. Many people might have that object, but it may point us in the right direction. For example, the object is rare and can only be purchased at this store and at this particular city. Rheumatoid factor is actually very common in Sjögren syndrome, a condition causing significant dryness of the eyes and the mouth. Up to 75% and 95% of people with Sjögren's can have a positive rheumatoid factor. We found in lupus, systemic lupus erythematosus in 15 to 35% of people, mixed connective tissue disease, about 50% to 60%, systemic sclerosis or scleroderma, roughly 20% to 30%, even polymyositis, 5 to 10%, and sarcoidosis, around 15%. Your immune system can be chronically stimulated by long-term infections or other inflammatory diseases leading to rheumatoid factor production. This includes chronic liver diseases like primary biliary cholangitis, chronic lung diseases like idiopathic pulmonary fibrosis. Infections are a big one too. Hepatitis C is notorious for this, with 20% to 75% of patients testing positive for rheumatoid factor. It can also be seen in hepatitis B, subacute bacterial endocarditis, tuberculosis, and even after viral infections like mononucleosis. Sometimes rheumatoid factor can appear in patients with certain cancers, particularly after radiation or chemotherapy. And here's the real surprise for many healthy individuals as well. Yes, you heard that. Rheumatoid factor can be detected in a small percentage of perfectly healthy people, usually at low levels. This becomes more common as we age. In 20 to 60-year-olds, rheumatoid factor is positive in 2 to 4% of people between the ages of 60 and 70, about 5%, and people aged greater than 70 years, rheumatoid factor is positive between 10 and 25%. It doesn't automatically mean something is wrong. Sometimes the immune system just gets a bit more aggressive with age. If a positive rheumatoid factor can pop up in all these different scenarios, how do we as doctors make sense of it? This is where true medical detective work, or what we call clinical correlation, comes in. One single test result is never the whole picture. We look at you, your complete clinical picture. This includes your specific symptoms. What are they? How long they've been there? How severe are they? Your detailed medical history, your family history of autoimmune diseases or other conditions. We need a thorough physical examination looking for signs like joint swelling and tenderness. Actual level or titer, which means the concentration of rheumatoid factor, can sometimes provide us additional clues. A very high level might be more concerning than a low positive, but it's still just one piece of information. Fortunately, we have other powerful tools in our diagnostic toolkit. When we suspect rheumatoid arthritis, a crucial partner to rheumatoid factor is another autoantibody called Anti-CCP. That stands for anti-cyclic citrullonated peptide antibodies. Think of Anti-CCP as a more specialized detective, one that's much more focused on RA. While rheumatoid factor is sensitive, meaning it's often positive when RA is present, anti-CCP is more specific. It's more likely to be positive only if RA is present and not as many other conditions. If both your rheumatoid factor and your anti-CCP tests are positive, the likelihood of you having rheumatoid arthritis increases significantly. Combining these tests gives us much greater diagnostic accuracy, especially in the early stages of RA. Now, what about the scenario where you feel perfectly healthy? You have no symptoms, but an RF test comes back positive, maybe from a routine check or screening for something else. Does this mean you're destined to develop rheumatoid arthritis? The answer is not necessarily, but it does mean that you have an increased risk compared to someone who is RF negative. It's like an early warning sign, a yellow flag that tells us to be observant. Many people with a positive rheumatoid factor never go on to develop RA. If you are RF positive and asymptomatic, meaning you have no symptoms whatsoever, especially if you also have a positive anti-CCP antibody, or a strong family history of RA, or if you smoke, which is a major risk factor for developing RF positive RA, your doctor likely will want to monitor you a little bit more closely. We sometimes refer to this as preclinical RA, a phase where the autoimmune changes might be starting in your body, but the clinical symptoms, like joint swelling, haven't appeared yet. Autoantibodies like RF and anti-CCP can sometimes be detected in the blood years before symptoms begin. In this situation, if you truly are asymptomatic, we generally don't jump to starting medications like DMARDs. That stands for disease-modifying anti-rheumatic drugs, which are specific treatments for conditions like RA. The current approach focuses on 1. A thorough risk assessment. This includes checking for anti-CCP if it hasn't been done, discussing family history and lifestyle factors like smoking. 2, education. This is key. Understanding early signs and symptoms of inflammatory arthritis to watch out is crucial. These include persistent joint pain, new joint swelling, morning stiffness that lasts more than 30 minutes. 3, lifestyle modification. The most important one here is smoking cessation. If you smoke, smoking is one of the best things you can do to reduce your risk. Maintaining a healthy diet, managing your weight, and good oral hygiene are also beneficial for overall health. Regular monitoring. Your doctor will advise you on how often you should have checkups. This allows for early detection if symptoms do start to develop. A common question I get is whether we should keep rechecking that rheumatoid factor to see if rheumatoid arthritis treatment is working. Generally, the answer is no. Rheumatoid factor levels don't always correlate well with how active RA is at any given moment, and they may or may not change significantly with treatment. Instead, to monitor RA, disease activity, and treatment effectiveness, we rely on symptoms, what we find on joint examinations, and other blood tests that measure inflammation more directly, like CRP, or C-reactive protein, or SED rate, erythrocyte sedimentation rate. Your doctor will explain which of these are most relevant for you. To bring our detective story to a close, that rheumatoid factor result, it's a significant clue, but it's just one piece of a much larger and very personal puzzle. It's an indicator, not a definitive conviction. The most important step you can take is to have an open and thorough discussion with your doctor, or preferably a rheumatologist. They are the lead detectives who can carefully consider all the clues, your unique symptoms, your full medical history, examination findings, and your blood results. Arrive to an accurate understanding of what's going on. Please don't let a single blood test result define your future or cause undue panic. Knowledge truly is power. Understanding what rheumatoid factor means, and perhaps more importantly, what it doesn't always mean, is the first step towards taking control of your health journey with confidence. If you found this video helpful and clarifying, please give it a thumbs up, and don't forget to subscribe to Rheum Doctor channel for more clear and evidence-based information on rheumatologic conditions. What was the most surprising thing you learned today about rheumatoid factor? Or do you have any other questions? Share your thoughts in the comments section below. For more in-depth articles, resources, and to learn more about our mission, please visit our website, rheumdoctor.com. See you next time.